So my diet is called twigs and berries because it's apparently the euphemistic term that people use to describe my diet. Lovingly, I'm hoping. But I want to start with a story, and this story highlights the incredible amount of just sheer genius that goes into what scientists and physicians do. And so this story starts in 2003, so not that long ago, and that time frame is important. There was a scientist in Montreal, and he actually discovers a protein. And he knows that this protein is on the short arm of chromosome 1. And he doesn't know quite what this protein represents, but it hasn't been discovered before, and he calls it NARC1. And around this time, there are physicians in Paris, and they are studying patients with really, really, really high cholesterol. High cholesterol, so high that it's coming out of their skin. Right? These are called Xanthomas. And they also knew that there was a genetic disorder that is causing this condition called familial hypercholesterolemia. And they knew that this genetic disorder was on the short arm of chromosome 1. But for 5 years before, they couldn't figure out what gene was coding this protein. So Dr. Nabil Saideh calls up this group and says, hey, this is my gene. And Dr. Christine Bolo says, no way. He says, I will bet you a glass of champagne that this is the gene you're looking for. And 2 weeks later, she calls him back and says, I owe you 3 bottles of champagne. Because it turned out that the gene that encoded this protein actually is one of a newly discovered, brand new discovered protein. In 2003, they published this research. And this is now the 3rd mechanism found for why people have really, really high cholesterol levels. So in a decade, and that number, just in a decade, we figure out that what this enzyme does is that it destroys the receptor that grabs the bad cholesterol, so the LDL cholesterol from the blood, and it brings it into the liver cell. And this enzyme, if activated, destroys the receptor so it cannot go back up to the liver cell to pick up more bad cholesterol. And for people that have gain of function of this enzyme, they have greater destruction of these receptors and therefore cannot clear cholesterol from their blood. So then these scientists said, wait a minute, if there is gain of function that causes very high cholesterol levels, what if there is a group of people that are born with loss of function? And it turns out at University of Southwestern, Dr. Helen Hobbs and Jonathan Cohen were studying people in the Dallas area with extremely low cholesterol levels. Bad LDL cholesterol. We target people with heart disease to have bad LDLs under 70. These individuals, some of them, that inherited both traits from their parents, their cholesterol, their bad LDL, as low as 14, naturally. Very low cholesterol levels. And as it turns out, the individuals that have very low cholesterol levels have the same enzyme, but instead of gain of function, they have loss of function. So what do you think the pharmaceutical industry is thinking right about now, right? They cured heart disease. So by 2015, so in about a decade, we find a brand new disorder, we create an antibody against this enzyme, we do clinical trials, and by 2015, the drug is already approved, right? In about a decade, the incredible success of translational research has created this drug. And these drugs can decrease your bad cholesterol from 50 down to anywhere from 50 to 70% reduction. So imagine what potentially that could do for the face of coronary artery disease. And as Dr. Helen Hobbs says, geneticists took a little while to understand this, but the pharmaceutical companies got it right away. This is big pharma at its very best. But let's look at the trial. Let's look at one of the key trials that talked about the outcomes that happens when you give patients this really, really powerful drug. Okay, we're talking 70% reduction in cholesterol levels. Well, we found that in evolocumab, which is one of the drugs studied, they reduced their cholesterol by 59%. But it resulted in a 15% reduction in combined cardiovascular death, heart attack, stroke, hospitalization for unstable angina, and the need for stents. And a 20% reduction for the combined risk of death, heart attack, and stroke. And there was no significant difference between this brand new drug and placebo, right? How many people have issues taking statin? Here, this drug had the same tolerability as placebo. But let's look at the data a little bit more clearly. The absolute risk reduction is 1.5%. And if you use statistics, that means you need to treat 74 patients to achieve the endpoints that's reported in the trial. So that if the drug costs $1,200 a month, which is about the cost, you're spending $14,000 per patient. But if you look at the number needed to treat one non-fatal heart attack, it costs $2.3 million. To prevent one stroke over the course of 2 years, it's $7 million. But the New York Times says, cholesterol slashing drug can protect high-risk heart patients, study finds. The BBC writes, huge advance in fighting world's biggest killer. An innovative new drug can prevent heart attacks and strokes by cutting bad cholesterol to unprecedented levels. 1.5% absolute risk reduction. So where does that leave us? Well, which is perhaps why the direct and indirect cause of heart disease is about $200 billion. By the way, obesity is $100 billion and diabetes is also an additional $100 billion. That from 2013 to 2030, that number is expected to increase another 100%. Also why we spend the most per capita on healthcare, and 17% of our GDP goes to healthcare. And if we compare ourselves to other developed nations, are we living longer? Yes, we are living longer, but we rank 42nd among industrialized nations for life expectancy. And the cost, right? The cost, especially to seniors. 25% of all senior citizens declared bankruptcy due to medical expense, and 43% were forced to remortgage or sell their home to pay for their health care. So something's got to change. You guys spend the whole day listening to the most incredible procedures, the most incredible, innovative techniques. At what cost? Not just financial cost, but of an individual, but what cost to society? This particular healthcare system, we are going to bankrupt our kids and their kids and their kids. So something has to happen. There has to be a paradigm shift in healthcare. Something has to change. We have to stop treating symptoms and start treating root causes. So it's not just an issue with healthcare, right? I mean, can doctors become smarter? Can pharmaceutical industries become much more efficient? I don't know. I think you saw today how amazing our healthcare system is. But we have 800,000 deaths in the US because of cardiovascular disease. One of every 3 deaths is attributed to heart disease. 22,000 Americans each day, a death every 40 seconds. And heart disease trumps all forms of cancer and respiratory ailments. Each year, this number is similar. Stroke, about 800,000 strokes. Of that, 185 are recurrent strokes. It's a stroke every 40 seconds. So how many seconds have we been here? How many people have had strokes just today? So it accounts for 1 out of every 20 deaths in the US, and a stroke is killing someone every 4 minutes. So why? Again, is it failure of our healthcare system, or is it our own failure? Perhaps we need to look in the mirror and ask ourselves, why are these numbers so astronomical? Well, 1 in 3 US adults don't engage in physical activity, and among high schoolers, only under a third meet the requirement for daily activity. And if we look at ideal health, 0.6% of kids and 1.5% of adults actually meet the criteria of what we define as ideal diet. And the prevalence of obesity is now 37.7%. And diabetes. So 9%, 3% undiagnosed, 34% are on their way to becoming diabetic, and this number is about 100 million people that are diabetic or on their way to becoming diabetics. And what about cholesterol? 40% have total cholesterol greater than 200, 12% greater than 240. 1 in 3 Americans have high levels of the bad cholesterol, the stuff that causes plaque. And now with the new hypertension guideline, right? So about a month ago, now about half of us, half the country, about half the country have high blood pressure. So this is a slide that just represents just a minutia of the metabolic activities that happen in each cell every moment of every day. And evolocumab probably, hang on, let me see which one it is. Maybe we're right about there. Changes 1 factor. Well, what about the rest? How do we affect all of this? And this is just a minutia. This is how complicated and complex our bodies are, and we continue to think that you can just throw 1 or 2 or 3 or 4 pills at this and think that we can change disease. You can't. You see the complexity. What we need is a complete wellness. A wellness that not just includes physical health, but mental health and the ability to have emotional resilience. And in the ancient wisdom of Ayurvedic medicine, disease and health have the same origin. If you are in balance, you have health, and when you are in imbalance, you have disease. It's that simple. So what we need is a comprehensive program. A program that changes the way we eat, a program that motivates individuals to move, a program that gives you the strength to have emotional resilience, and most importantly, love. So let's look at movement. Exercise improves your triglyceride levels, it improves your HDL cholesterol, that's the good cholesterol, it lowers the bad cholesterol, it improves your blood pressure, it improves your glucose levels, it improves insulin sensitivity, it improves inflammatory markers, 59% risk reduction. Do you guys remember what the risk reduction was for evolocumab? Right? 15%. Improves endothelial function, enhanced vagal tone, improves the blood vessel health, the health of the blood vessel, an additional 41%. And tell me, is it going to cost you $7 million to learn how to put on a pair of walking shoes and walk? It lowers the risk of stroke by 27%, reduces the incidence of diabetes by half. 50% reduction. And ask yourself, what is the cost of this? It is as effective in early depression. It is as effective as taking 1 drug. just exercising is as effective as taking one antidepressant for early depression. And in the older individuals, that improvement in muscle strength has been also linked to decreased mortality. Food, the twigs and berries. We are what we eat. We are what we eat. We are what we eat. Hippocrates said, "Let food be thy medicine and medicine be thy food." You guys have heard me, some of you guys have heard me say this. Right, when the first ever hospital came up in the world, it was next to a stream with watercress because he understood how amazing the medicinal properties of that one plant was. So there's thousands and thousands of data on the power of food, and I am just going to grab just a few. Whole grains. Eating whole grains, you reduce your all-cause mortality, you reduce your cardiovascular mortality just with one serving. If you increase that to 3 servings, 15% reduction in cancer mortality. And what's really cool, you just eat whole grains, do nothing else. You can sit on the couch and just eat whole grains. You actually increase your resting metabolic rate, which means that in 1 year, you lose 5.5 pounds just by eating whole grains. What about the majority of us that tend to perhaps lean on towards beef? There's actually over 800 studies that for each additional serving of processed meat, your total mortality increases by 20%, cancer mortality by 16%, cardiovascular mortality by 21%. And you're going to say, okay, well, what is this bogus data? Well, actually, the science is really, really, really sound. And it comes from studies such as the health professionals follow-up study, the nurses' health study. And you can see, as your intake of red meat increases, so does your mortality. So in this one particular study, looking at people under the age of 65, if you got 20% or more of your protein from red meat, your premature death increases by 75%. And this is what's interesting, there is a 400% of risk of dying from cancer and diabetes. And you're going to say, well, I don't get it. There's no sugar in meat. How do you get diabetes? And so the science is that when you eat animal protein, you actually cause a greater secretion of insulin than eating a carb. What about the opposite? Fruits and vegetables, you reduce your systolic blood pressure, you reduce your blood sugar. Diabetes incidence goes down by 12%. All-cause mortality, 5%, cardiovascular mortality. This is just one serving a day. Now, if you increase it to 7.5 servings a day, you start to see cancer mortality. And maybe this was done in 1 or 2 patients, maybe 10. No, this was looked at 2.1 million subjects. What about dairy? Well, if you actually replace dairy, just 5% of animal protein, and you switch it to plant-based protein, you actually reduce the risk of dying from coronary heart disease by 24% and a 25% risk reduction in stroke. And if you have prostate cancer and you drink a glass of milk, your mortality increases by 43%. So this was given to me by one of my patients, and I made him go through the Ornish Program, and he says, my GI doc thinks I'm getting too much fiber. So talking about fiber, looking at over 500,000 patients over 4.5 years. If you get 35 grams compared to people that only get 15 grams or lower, you reduce colorectal cancer by 40%, liver cancer by half, and breast cancer by 5%. Just fiber. And what about sugar? Unfortunately, there's no happy story here either. on quartiles of people where their daily calorie, if 10 to 24.9% of your calories come from sugar, you increase your cardiovascular mortality by 30%. When you increase that to 25% or more, look at your risk, it goes up 175%. And this is consistent across the board, no matter your age, your weight, your race, your education, your ethnicity. And this is recent data. So just in time for Valentine's Day, we have to talk about love. And love is so very important because people that have depression have a 3 to 10 times higher risk of mortality because of heart disease. And if you take a patient, and there was a study that looked at patients that have had heart attacks, and we put a stent in, so we fix them, we fix the blockage, and they go home. And they went home to an empty house. The risk of dying in 6 months was 4-fold higher than if they went home to family. Doesn't matter how dysfunctional, actually, just family. 4 times higher risk of death if you have depression. And the impact of depression remained after multiple controls. But you can say, well, maybe one person was sicker than the other. No, it doesn't matter. Maybe one person had a bad heart muscle function. No, it across the board, doesn't matter. Just having depression increased your risk. And in the end, we are all just humans, drunk on the idea that love, only love, could heal our brokenness. The other component of this 360 wellness is emotional resilience. And how do you achieve emotional resilience? This is achieved with mindfulness, but really we're talking about meditation. And now there have been many, many studies using EEGs, MRI, functional MRI, that looks at brains of people that meditate. And if you meditate, you actually create neuroplasticity. That means you are creating, recircuiting new areas that light up because you meditate. And these specific areas increase awareness, self, and emotion regulation. So you're actually changing brain function. I love the present moment, now, more than I love anything. And for those of you that don't want to sit down and twist into a pretzel and say, "Om," you just have to practice one thing. Just practice mindfulness. Be in the moment, as you are, right now, in this moment. You are here, you're in this room, maybe you hear jostling, you feel the temperature of the room, you hear my voice, you're here, you're with me at this moment. And if you can be present at this moment right now, and you have control of this moment, then you have control of the next, and the next, and the next. So if you put all of these components together, you have the Ornish Program. And it's a program that's based on 4 pillars: teaching people how to eat, teaching people how to love. It's, for some individuals, it's not intrinsic. For teaching people how to manage their stress, how to connect, and how to exercise. And these 4 pillars, if you've got these 4 pillars, you can control disease. You can actually prevent disease. The studies range anywhere from 70% to 90% reduction in chronic illness. Imagine if we can cure diabetes, heart disease, high blood pressure, stroke, cancer, depression, anxiety. Where does that leave society? It would be an amazing world. So Dr. Ornish says when we understand that what we gain is so much more than what we give up, our choices become joyful and meaningful, right? That's the point. People always say, oh my God, how do you just eat twigs and berries? Because you guys, that's my challenge. It's my challenge to all of you. Try it. Try it for 2 weeks and see what happens to you. Because when you feel so amazing, you don't think that you're giving something up. Because what you gain is so much more than what you give up. And what do his studies say? Well, the data is pretty darn profound. Here is the group of individuals where we are looking at their blockages, and what's this curve doing? Over the course of 1 year, 5 year, it's a sustainable result. The curve continues to go down. Their percentage stenosis, blockage, gets smaller. We are reversing heart disease, and what about the control? The control is going the other way. And the control, mind you, is on aspirin, they're on a beta blocker, they're on an ACE inhibitor, they're on statin, and now maybe they're on the hot new drug PCSK9 inhibitor for $2 million. 99% of patients stopped or reversed their heart disease as measured by cardiac PET scan. In contrast, 45% of controls got worse, 50% showed no change, and only 5% improved. Right? Usual care is not the answer anymore. There has to be a shift in the way we deal with healthcare. There was a 400% improvement in coronary blood measured by cardiac PET scan after 5 years. After 5 years, right? We're talking about sustainable change. And this is, again, Dr. Ornish's data. This is a PET scan. It measures flow function. And what you are seeing is this is before a person starts the program, and this is after. Look at what happens. You want to see all this yellow-red. This stuff, that's reduction in flow. And you can see how much there is improvement in anatomy, function, symptoms, prognosis. 99% of patients showed improvement or no change in their PET scan after 5 years. 99%. See, when you talk about lifestyle medicine, you don't need 50,000 patients, as they do in these clinical trials. Why are clinical trials using 50 to 60 to 100,000 patients to test their drug? Because their change is such minute that they need those kind of numbers to show statistical significance so that it shows up in New York Times and BBC talking about how this drug is going to change the face of healthcare. Where was this article? 99% improvement. If all of you guys out there, and you are in the healthcare field, you need to ask yourself, why did you go into medicine? And for you that are not in healthcare, I would be pissed. By following the program and making lifestyle changes, 77% of patients who were eligible for bypass surgery or angioplasty were able to safely avoid these procedures. I want to clarify. So a person comes in and their doctor says, you need a stent. You have a 95% blockage. And the guy's like, no, I don't want to do it. I'm going to eat twigs and berries. We took all these patients and we found that 77% can safely avoid doing nothing other than those 4 pillars that we talked about. What are our numbers? We've got Meredith in the audience, and we have this awesome participant, Jeff, in the audience. Jeff, if you can just wave your hand. And if you guys, if you can find the time to talk to Jeff, he will tell you how this program has transformed his health, but importantly, his life and his prognosis. So our numbers, 10, this is just a pool of 10 cohorts. This is an older slide. We've had more cohorts since. 55% reduction in depression score. Do you know that by 2020, depression is felt to be the second largest contributor to chronic illness worldwide? And we have a 55% reduction in improvement in depression scores. 33% increase in functional capacity, 87% reduction in cholesterol of what they ate, 19% reduction of LDL, and about 1,000-pound combined weight loss. Right? But I put weight loss at the end because, you know, I don't want people to walk out of here saying, hey, I can go on this program and lose weight. Right? That's the least of our numbers. The number is, the great part of this program is how we change the face of chronic disease. And I just want to highlight a quick patient, 50-year-old police officer in UCLA goes in, he's got, you know, goes in with a heart attack, has a major blockage, they fix it, but they found that he has this blockage here in another blood vessel, which didn't need to be fixed. But sometime from June, this was in June, in September, he presented to his doctor saying, God, I just have that chest pain again. And they're like, well, but I don't understand. We fixed you and now you're on this Ornish program. How could you have chest pain? Like, I don't know, I just have chest pain. Well, it turned out he had indigestion because this was what his artery looked like from June to September. Here's the blockage, and here it is later. In 5 weeks of the program, his blockage all but disappeared. 5 weeks. I want to end this talk again on love. If there's anything you guys get from this, is that you have the power to change the face of disease, not only in yourselves, but in society as a whole. If I affect one person today, then all my efforts are worth it. People are fools who think that by changing one person, we cannot change the world. We are the world, a tiny fraction of it. And when you love and change someone, you mold together a tiny little broken piece of the universe. Thank you.